On a Friday. My name is David Martinez. I am a director at Vitalyst Health Foundation. I'm joined today by my colleague Michelle Goodthunder, who is watching that waiting room and also the chat room. So as we get into the introduction of Vitalyst Health Foundation, feel free to put your questions in that chat room. But after a slide deck, we'll come back into this gallery view and have an open Q&A where folks can unmute themselves and we can just be in community with each other. But this is our monthly Vitalyst 101 series, essentially, for those folks that are not yet familiar with Vitalyst Health Foundation. We use it as an opportunity to introduce you to our grant making side of the house, but also our programmatic priority areas so that you can, as you're exploring potential partnerships, see if and where there might be some alignment, and then we can follow up on how you can discover that formal partnership. But to get us started, we have a couple of housekeeping items. We want to make this as accessible as possible for our partners. So for our bilingual friends, we encourage folks to email conversemos@vitalysthealth.org. We have bilingual staff members who can have a conversation. We also have closed captioning available via Zoom services, so you can enable that option. All the lines are muted as you've entered the webinar, but as I mentioned, we'll have a live Q&A session at the end, but feel free to use that chat room with questions as they arise. And my colleague Michelle can answer them, and we can also reflect on them at the end. All of the slides, this recording, and additional materials will be shared via email to all of the registrants for this session and posted to the vitalysthealth.org grants and partnership webpage. So let's get started. Vitalyst is a Phoenix-based but Arizona-serving health foundation. We have a vision that all individuals and communities in Arizona are healthy and resilient, and we're on a mission to do that to connect, support, and inform efforts that improve the health in individuals and communities in Arizona. So if you're working outside of Arizona, but your service is being done to benefit and improve the health of communities and people in Arizona, we can still explore partnership. Certainly, if you're Arizona-based and doing your important work in Arizona, we can explore partnership as well. But if you are especially a national entity doing work outside of Arizona, our work is specifically to support Arizonans. You'll also see some keywords here: connect, support, and inform. Those are really important aspects of our work at Vitalyst Health Foundation, and you'll see that embedded in all of our grant making and programmatic priority areas, our goals and priorities as well. As a health foundation, we obviously focus on efforts to improve health, which includes the specific area around healthcare, but we see health as more than just healthcare. So we look at the broader social determinants of health, or what we call the elements of a healthy community. We often refer to this visual and affectionately call it the wheel, which really reflects all of those elements of a healthy community, those social indicators of health. So as you begin to explore, am I aligned? Are my efforts aligned? Is my organization aligned? Is my coalition or collaborative aligned with Vitalyst? If you're improving health and see yourselves in one of these elements, or see your efforts in more than one of these elements, you're already finding some mission alignment with Vitalyst Health Foundation. If you don't see your specific area of focus in one or more of these spokes of the wheel, it might be because they are actually embedded in a specific spoke. And again, if you go to vitalysthealth.org, we have a whole webpage that's focused on the wheel and takes a deeper dive into each of these spokes. So for instance, that spoke on social justice, that's a really broad topic, right? But it can include concepts around restorative justice, civic engagement, community empowerment as well. So each of the elements in the materials that we have posted on our webpage takes a deeper dive connects with specific health outcomes that further show that connection on how, in this instance, say social justice actually is indeed connected with health outcomes. Vitalyst works across this wheel, especially when we look to our grant making side of the house. So again, this is what we use to find mission alignment. Our work also really holds equity and resiliency at the center of our efforts. So you'll see that embedded within the wheel. We also really look towards the intersectionality of all of these things. While your efforts might be focused on one or two of the specific spokes, it really is an effort that we have to connect the intersectionality of these and see that the wholly encompassed wheel, all of these elements are critical to ensuring that we have healthy individuals and healthy communities in our great state of Arizona. Vitalyst ensures that we achieve our vision and mission by focusing on these three goals. A lot of the work of Vitalyst is done in coalition and collaboration because as you'll see in just a little bit, our focus as a health foundation often takes a common public health approach to improving health, which means we take a more systemic approach. An upstream approach is what you might often hear rather than, say, a downstream approach, which means that we focus a lot more on policy systems and environmental changes. That's heavy work. That takes a village. So the goal area around collaborative networks, really working to improve the conditions that impact health, is a really big component of Vitalyst. At the same time, we recognize that those collaborations are made up of individual community partners that themselves need to be strengthened. So our second goal is focus on strengthening community partners, really ensuring that they're equipped to advance health equity. As I mentioned, we hold equity at the center of our work as well. And one way that it comes to bear is our work specifically focused in those communities and populations throughout Arizona that have the greatest health disparities, especially in rural and tribal communities throughout Arizona, as well as the borderland communities. As I mentioned, Vitalyst takes a more upstream approach to improving health, both through our programmatic priority areas, but in our grant making as well. That upstream approach often involves policy and advocacy and informing decision makers, and that's our third goal. So we really have a focus on both internally utilizing Vitalyst voice in the advocacy sphere, advancing policy, working in collaboration with other advocates and policy-oriented folks to prioritize community health and well-being, especially doing a lot of work at the state capitol and in different cities throughout Arizona. While Vitalyst is based in Phoenix, we have partnerships throughout the state of Arizona. They'll obviously have a great presence here in Maricopa County. Those three goals each have activities reflected in our three programmatic priority areas. So I like to say that Vitalyst has sort of three sides of our house. We are a foundation, a grant making foundation. So one side of our house is grant making. And I'll explain more about that side of the house in just a couple of slides. The other side of our house is our fiscal sponsorship program called TAP-AZ, or the Technical Assistance Partnership of Arizona. I won't go too deeply into TAP-AZ. I won't go deeply at all into TAP-AZ in this session because it's mostly focused on Vitalyst grant making and Vitalyst programmatic priority areas. But our team at TAP-AZ has another monthly 101 session that does go deeper into TAP-AZ, what fiscal sponsorship is. So if you're interested in exploring how your entity might come under our 501c3 status, which is one type of fiscal sponsorship, or if you have already are a registered 501c3 nonprofit, how you might have a fiscal agent or a grant-specific fiscal sponsor if you need help with that back office finance and accounting. So tapaz.org is the website where you could go to learn more and register for that monthly 101 session if you're interested in that side of the house. And then finally, the third side of the house at Vitalyst are these programmatic priority areas. This is where we operate a little bit differently than some foundations that focus just on grant making. This is where we have internal capacity to focus on key health impacts and that are priority areas and urgent health issues in Arizona. We often set these priorities on an annual basis and usually have these priorities set for the longer term because they are tied to an individual director and subject matter expertise that we have internally. In for the past few years and the foreseeable future, our programmatic priority areas will be civic health, healthcare integration, and housing. Um, it's important to note that we have these three programmatic priority areas, and as I reviewed just in the previous slide, we have three goals. So there are activities that are connected with these three goals within each of these three programmatic priority areas. So for instance, in addition to directing our grants program, that again we'll review in just a little bit, also direct our civic health programmatic priority area. So that really is focused on supporting long-term efforts that improve active community participation. The concept of civic health, excuse me, the concept of civic health is really all about how community, engages in our government, engages in opportunities in community and in government to improve health. And often the systemic barriers that exist that impede an Arizona's ability to engage in their community and government. Again, taking that systemic approach, we focus on those drivers that allow or impede an Arizona's ability to engage in their community and government, often focus on the census, redistricting, and election policies. So in our civic health portfolio, the collaborative network, remember that goal, collaborative network we support in our civic health work primarily focuses on One Arizona, which is a coalition of about 30 grassroots community-based organizations focused in those communities and populations that have the greatest disparities in health that are doing work in census redistricting and voting access. We also support other collaborative networks like the Arizona Civic Life Partnership in collaboration with the Center for the Future of Arizona and the Flynn Foundation to improve the civic health progress meters of Arizona. So those are some aspects of collaborative networks that we support. We also support efforts to strengthen community partners in the civic health space, especially around capacity building to ensure that those entities are strong as they work in coalition. And then we do a lot of efforts around advocacy, again, to the goal of informing decision makers, especially as the Capitol is abuzz right now. The state legislature is in session. So there's a lot of bills being proposed around, say, election policies that are impacting our civic health work. So we do a lot of advocacy work. And then, of course, you'll see my mug there. The next person next to me is my colleague Anna Rossetti, who directs our healthcare integration work. This is really how the physical, mental, and social determinants of health are all integrated. Again, health is more than just healthcare, though Anna's portfolio does include areas around healthcare, especially Medicaid, because as you know, with the passage of HR1 at the federal level having direct impact on Medicaid, which in Arizona is known as Access or Kids Care, which is having a tremendous impact on our community health centers, especially in rural, tribal, and border communities. So Anna has been working really diligently, again, with collaborative networks. Remember that goal, coalitions, especially the Cover Arizona Coalition, to ensure that Arizonans are able to access the marketplace, affordable care options, and being able to navigate the private marketplace as well, especially during these challenging times when many Arizonans are falling out of access to care. Her portfolio also oversees a lot of efforts to strengthen community partners in healthcare workforce and other top health disparities in Arizona, including maternal and child health, mental and behavioral health as well. Um, as our Anna is our lead state lobbyist as well, so she takes our lead for public policy for Vitalyst and is our advocate and policy lead on a lot of efforts. But that connects us with our next colleague, Gabriel Jaramillo, who directs our housing work. Gabe's work to inform decision makers in housing is a really big component of his work. So he's often down at the state capitol working on legislation around housing. He also works in collaborative networks, especially the Arizona Housing Coalition, and strengthening housing partners, especially to show promising practices in especially affordable workforce housing. A really cool effort happening throughout the state, supporting efforts that are utilizing vacant land owned by various institutions like churches, community centers, or community health centers, community colleges, schools, to utilize that land, connect them with nonprofit affordable housing builders so that they can meet their workforce housing needs, but also those communities throughout Arizona have more affordable housing. And then our colleague Sergio Paris noted there, he is our director of strategic communications. He helps tells our story at Vitalyst and also the story and the impact of all of our grant partners. He doesn't have a specific portfolio area because, again, our programmatic priorities are focused on civic health, healthcare integration, and housing. But as you'll learn in just a little bit, we have an open door policy at Vitalyst, and so long as you see your alignment, mission alignment within that wheel, the elements of a healthy community, we can discover partnership. And because of Sergio's background and expertise, especially in food systems and education, if you're doing work in those areas, even though they're not a programmatic priority area of Vitalyst, you still may find alignment with one of our grant partnerships. And he helps facilitate a lot of those conversations with prospective partners because of his background. So as I mentioned, Vitalyst, three sides of the house, our grant making, TAP AZ, our fiscal sponsorship, and then our programmatic priority areas of healthcare, housing, and civic health. While those three areas are our priorities, more so for internal work with external partners, it doesn't mean that we can't work with you if you are working outside of those areas. Again, we look for alignment, especially on our grant making side of the house, with the elements of a healthy community wheel, that wheel visual. And that is often more so connected through our grant making, which is framed through our responsive grants program. We have a three-tier grants program at Vitalyst Health Foundation, the Technical Assistance Grant, the Spark Grant, and the Systems Change Grant. At Vitalyst, we try to practice this concept of trust-based philanthropy, which is a principle within the philanthropic sector that that hopefully moves us away from a more transactional relationship to a more trust-based relationship with our partners and deepen that for greater impact. One of the principles of trust-based philanthropy is multi-year funding as general operating grants as possible, providing greater technical assistance beyond just grants, and that's really how we have framed our grants program. So in total, these three grants make up a total partnership opportunity of 5 years, nearly $225,000. But what really matters is where you're at in your journey towards systems change. So each of these three grants is meant for collaboratives working towards systems change. Again, taking that upstream approach to improve health, focusing on policy, systems, and environmental changes. So as you're thinking, am I finding alignment with Vitalyst? This is a big area for you to think about, because if you are not working in an upstream fashion, if your efforts are more downstream interventions, more programmatic or direct service in nature, that work is very, very important, but already misaligned with how Vitalyst frames our grants programming. So there likely isn't a grant partnership opportunity that is aligned with Vitalyst. Again, the direct service, the programmatic work, these downstream interventions are very important, but Vitalyst leadership and board has selected to narrow and focus our grant making side of our house to focus on systems change work, those upstream interventions. And We frame our grant partners ship opportunities in these three areas, again, depending on where you're at in your journey towards systems change. As I mentioned, we have an open door policy at Vitalyst. So we can explore or discover partnership with just about any entity that is finding alignment, both mission alignment and alignment with one of our grant types, and taking a collaborative systems change approach. And if you visit vitalysthealth.org and go to our grants and partnership webpage, you can just do a little bit more research to see if there is alignment with our grant partnership opportunities. And as you see that alignment, you can select which grant type you might be most aligned with, either, again, the technical assistance grant, the Spark grant, or the system change grant. And then as you see that alignment on that webpage, there is what we call the discovery intake form. We use this discovery intake process to discover partnership. So that intake form is not a formal application, a formal grant application. It is simply an intake form that is helping us facilitate the relationships through this open door policy we have, and so that we could get to know more about you, your organization, your collaborative, and your systems change project, and then see where there might be alignment with one of our grant partnership opportunities. And as you'll see in just a few slides, um, then we follow up on next steps with the more formal application. So if you are seeing alignment with Vitalyst mission, with your efforts, a collaborative approach towards systems change, then you would complete the discovery intake form. Once you complete the discovery intake form, which is again just an interest form, you complete some basic information about your entity, your collaborative, your systems change project, which grant type you feel you might be aligned with. We'll receive it, review it, and if we do see alignment, then you'll receive a prompt to schedule a time to chat with one of the Vitalyst team members. So those four folks that you saw on the previous slide, either myself, Gabriel, Anna, or Sergio, depending on which element of a healthy community spoke of the will your work falls into, so that you're having a conversation with somebody that has a little bit more expertise and background in that area. So for instance, I mentioned Sergio, if your collaborative efforts are working in the educational system, you would have a conversation with Sergio. If your efforts are around housing, excuse me, or more built environment stuff in healthy communities, you would connect with my colleague Gabriel. If your efforts are in healthcare directly or connected with behavioral and mental health, maternal health, other public health efforts, your conversation would be with Anna. So now let's take a deeper dive into each of these grant types, but allow me an opportunity to clear my throat. Okay, so the first of our three-tiered grants program is the technical assistance grant. For those who have history or have engaged with Vitalyst in the past, you might be familiar with the technical assistance grant. The important thing with this is that a couple years ago, we pivoted and streamlined that past technical assistance grants to be more so aligned with our larger systems change grants program. So we pivoted away from supporting individual nonprofit capacity building and technical assistance support to be more streamlined to support the capacity building of collaboratives working towards systems change, a big change difference with our technical assistance grants. But this first tier grants allows us another year potential, another investment opportunity towards this multi-year general operating funding concept. So if you are an entity forming a collaborative that wants to work towards systems change, but you don't know, you have not yet built those collaborative partnerships, and even if you have identified those partners and you've begun to meet, you really haven't built up the necessary components that would make a strong collaborative to then be in a better position to plan and implement systems change. You need some time to build up that trust, to build up the infrastructure, to build up your community or your capacity and specific technical assistance needs of that collaborative. This is what the technical assistance grant is made for. It is a a grant that's up to 1 year, up to $20,000. And we say up to 1 year and up to $20,000 because it really does depend on what your specific capacity building needs of are for that collaborative. So if your collaborative is at the early beginning stages and you need help to identify your partners and then begin to convene those partners over, say, a 1 year time frame, then your grant would be up to 1 year and perhaps even up to $20,000. But if your collaborative is already convening and you know that you need to work on a specific kind of component of your collaborative, say you need to build up your communications infrastructure so that you're then in a better position to plan and implement systems change, that might be a smaller scope of work, a smaller time frame, a smaller financial need. So your grant amount for the technical assistance grant might be smaller. It really does depend on that specific scope of work. We help narrow that specific capacity building need, often with a strong local consultant who can then meet your specific capacity building need. So Vitalyst has built this team of more than 250 strong local consultants across the state of Arizona that have deep expertise in a variety of capacity building arenas that can then be matched to help address your capacity building needs. If you have a relationship with a strong local consultant that knows you, understands your efforts, and can address your specific capacity building need, awesome. We trust our partners, we take your discretion, and we would have you work with them to collaboratively draft a scope of work that would address that capacity building need. Think through what the scope of work is. What are those key deliverables? What is your anticipated timeline? What is the compensation and the financial need to address that scope of work? And that's what you would propose as your technical assistance grant in collaboration with that consultant. If you don't have a consultant in mind, through our discovery consultation calls, we can help you think through and maybe curate a list of consultants that might be a good match for you and then play a little bit of a matchmaker. Or if your capacity building need is broad enough, we often do what we call for consultants. So we'll work with you to draft a preliminary scope of work and then send out almost like an RFP, but we call it a call for consultants. We'll send out an email saying Vitalyst is discovering partnership with XYZ collaborative or lead entity to address this specific capacity building need. If you feel you have the expertise and the background and the capacity to take on this contract, send us a note back with your resume, CV, or your LinkedIn or website. I build up that list and then share it with the partner and again, play that kind of matchmaker, but ultimately take partner discretion to select which consultant they'd like to work with. Once we're at the point of, yes, there is alignment with technical assistance grants and your effort, then we collaboratively work with you to draft a scope of work, a proposal that would reflect these 5 criteria aspects for the technical assistance grant. These 5 criteria pieces are the same 5 criteria that you'll see for the 2 other grant types we have, the Spark grant and the Systems Change grant. But it really does, again, depend on where your collaborative is at in their journey towards systems change. So for instance, for the technical assistance grant, your collaborative is at the beginning stages of your journey towards systems change in the early stages. So the criteria around collaborative reflects that. So in this instance, the criteria for collaborative, it doesn't mean that you have to have formed a collaborative, right? That's what the grant would may help you do. So in this instance, a single entity, a lead nonprofit or fiscally sponsored entity serving Arizona can be the single recipient of the technical assistance grant. You'll see this evolve as we get to the Spark and Systems Change grant. So this is the only grant where we allow one entity to request the technical assistance grant. The other components, the collaborative has to be a bit more formed as part of that criteria. The effort still has to work to improve some health outcome, but again, you're at your beginning stages, so you might think our efforts are to improve diabetes in Arizona. It can be that broad, but hopefully you have a plan to think more specifically, especially tying in the criteria around health equity and thinking through not only do we want to improve diabetes rates in Arizona, but improve diabetes rates holding an equity lens for those populations or communities that have the greatest diabetes rates in Arizona, for instance. That would be the connection to health equity criteria. The system change criteria for the technical assistance grants, again, you're at your beginning stages. So you know you want to take a systemic approach. You're not taking a direct service or programmatic approach. You really are looking at those upstream interventions. You're not there yet. You know your systems thinking, systems level, systems design, systems change efforts approach, but and you know what system you want to have changed. You just don't know your specific interventions or solutions. That's okay, right? Because you're at the beginning of your journey towards systems change. I hit a little bit on health equity. One other aspect that we assess health equity is the utilization of disaggregated data that really begins to hone in on the specific health outcome and the populations that have the greatest health disparities. So that's one way for health equity to be assessed. Another way, and this is really important because those closest to the problem should be closest to the solution from the beginning. So we really want you to engage as you're building up your collaborative, those community folks with lived experiences in the health outcome that you're hoping to improve. And then, as I mentioned, this technical assistance grant is a up to 1 year grant, up to $20,000. And as you're drafting your proposal for the technical assistance grants, reflecting each of these criteria pieces, you should note how you intend on leveraging the funding and what is the scope of work and those key deliverables that would be funded with this technical assistance grant. So if you're finding an alignment with the technical assistance grants, again, you would go to vitalysthealth.org, complete the discovery intake form. We'll receive it, review it. If aligned, you'll receive a prompt to schedule a time via Calendly to virtually meet with a Vitalyst director to have that initial discovery consultation, see if there is alignment. And if there is, the director will invite you we'll work with you to collaboratively draft that scope of work and invite you to submit that as the formal application or the formal proposal. Again, that application, the proposal is simply a 2-page document or so that reflects all of those 5 criteria that we previously discussed. The technical assistance grant, because it is simply up to $20,000, it does not need approval from the Vitalyst Board of Trustees. So we have set up an internal review process with our staff team here at Vitalyst. So as we review these discovery intake calls and have these discovery intake consultations and find alignment with this technical assistance grant, we then again receive your draft proposal, and the director will then plug it into our internal review process where we bring our team together, review the proposal, review against those 5 criteria pieces, and reach consensus on whether to fund or not to fund. Or we might say we have additional questions and how can you clarify your proposal so that we may get to a yes and reach consensus to fund. If the team reaches consensus and gives a thumbs up to supporting, then we begin to formalize the partnership with an official grant letter and then distribute the funds. So they're dispersed on a rolling basis throughout our fiscal year, which goes July 1 to June 30. So there is no deadline for the technical assistance grant. You would simply go through the discovery intake process. The only really big consideration we have for this is our budget capacity. So we are just passing our halfway mark in our fiscal year. We still have budget capacity this fiscal year for technical assistance grants. So continue to have conversations and explore this partnership. Before I go into the Spark grants, I'm going to take another drink. Okay, so you have your technical assistance grants, you built up the collaborative, the capacity building of your collaborative. Now you're ready to really begin to take a deeper dive into your systems change efforts. The Spark grant is meant for those collaboratives that have formed. Now they need time to plan their systems change. So think of the Spark grant as a planning grant. We want to provide you with some space and grace to provide to bring your collaborative partners together and begin to think through, okay, let's plan and think through what are those specific interventions and solutions towards systems change. So you have with the Spark grant, 1 year planning, $25,000 so that you can bring your partners together and begin to essentially a strategic planning process, thinking through what are those specific interventions or solutions towards systems change. Again, this is the same 5 criteria that you saw before, but again, your collaborative is moving forward in the systems change continuum. So you're just continuing down your journey towards systems change. So in this instance, your collaborative hopefully has had their capacity building met with the technical assistance grants. You're moving beyond that. So your collaborative is a bit more formed up. This is the criteria for collaborative. So in this instance, you see you need more than just one partner now. You need a collaborative, at least 2 partners, and we really encourage folks to have at least 3. We're really looking for quality over quantity. We want to ensure your collaborative is made up of the right partners that will help advance the specific interventions or solutions you have for systems change. So that's the collaborative criteria. Similarly, for the health outcome, hopefully you're beginning to look a bit more deeper into the specific health outcomes that you're hoping to improve. Again, this is a great way to connect with the health equity criteria, ensuring that you're really focusing on those communities and populations that face the greatest health inequities in that specific health area. Systems change, again, you don't yet have to know your specific interventions or solutions, but you're planning towards those. So you know what system you want to be changed. Now you need to plan the specific systems change work, and that's what this criteria would help cover. I reflected on some of the components of health equity, again, continuing to engage those closest to the problem, closest to the solution. And then for this, the budget again provides you with $25,000. You have a year's worth of planning. For this, the criteria, the narrative for the budget should be consistent with the scope of work. For the Spark grant and also for the systems change grant, we can provide you with a template to help think through what are those expenses that can help you better match the consistency with the scope of work and your budget. Similarly, for Spark grant, we review these through our discovery intake process. So if you're finding alignment with this grant, you would complete a discovery intake form. We review it. If there is alignment, you would schedule a time for us to chat. The director will then walk through your idea, maybe review a draft proposal, and if they see alignment, then and see a fit, invite you to submit a proposal. Because this grant amount is at the $25,000 level, we do have to get approval from the Vitalyst Board of Trustees for this grant, which is why we have a grant cycle for this. We have a fall grant cycle and a spring grant cycle for the Spark grant. So in this instance, we have a spring deadline for the Spark grant, which is May 7th. So we can begin having discovery intake calls if you're finding alignment with the Spark grant and essentially queue you up so that once we get to this deadline, then you're queued up and we're able to review your Spark grant proposal for the spring deadline. Last but not least is the systems change grant. So again, we're just going along this journey towards systems change. You've built up your the capacity of your collaborative, maybe with the technical assistance grants. You leveled up so that your collaborative can plan towards your systems change with the Spark grant. Now the next level up would be the systems change grant. Your collaborative is built. You've done your planning. Now you just need funding and time to implement your systems change grant. So you can think, or your systems change effort. So you can think of your systems change grant as an implementation grant, implementation funding. So this is again meant for those collaboratives that are working towards systems change. So the same 5 criteria, but in this instance, you know the specific interventions and solutions that your collaborative needs to implement to achieve your systems change effort. So the criteria around systems change is much more specific. You need funding to help implement your systems change effort. So the criteria around systems change is much more focused on what your specific project is and how it's designed. Similarly, the criteria around collaborative, your collaborative should be really strong, really formed up, maybe upwards of at least 2 year history to be able to be in a better position, have a strong collaborative, definitely more than two, hopefully more than three core collaborative partners. Again, focus on quality over quantity to ensure that you have the core collaborative partners needed that would help you advance your systems change. The health outcome criteria, a little bit more specific as well. The previous example with diabetes, at this point, it should be much more specific than simply improving diabetes rates in Arizona. It should be, again, tying in the health equity lens, using disaggregated data, really thinking through the specific health outcomes you hope to achieve, utilizing the elements of a healthy community will for specific metrics as well. In addition to the disaggregated data utilization to ensure that you're focused on a specific population or community with the health equity lens, again, continuing to engage those closest to the problem, closest to the solution. In many instances, tying this in with the budget criteria around adequately compensating community members for their time and expertise as well, compensating other community partners that may be engaging community and lived experience folks as well. And then with this, the budget much more advanced because this is a 3 year grant of up to of $175,000 total. So 3 years total, $175,000. It's multi-year to help you implement because system change is hard work. It takes a long time. Even while beyond the 3 years, certainly maybe in many instances, the 5 years in total we have as grants partnership, but hopefully with our support, you can make some really strong advancements, if not success, with your systems change effort. The systems change grant, we also encourage folks to go through the discovery intake process, but this is also an open grant application. It's an annual grant cycle that is usually held in the fall. So we are going through our process right now. Our grant cycle is closed for the systems change grant. It'll reopen in the fall, usually in the August, September timeframe with an October, November deadline. And then we go through our review process now. You don't have to go through the discovery intake form to submit a systems change grant application. You can submit a proposal directly. However, we highly, 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 highly encourage you to go through the discovery intake form because it will only make your proposal that much more stronger. And even though the grant cycle is currently closed, we can still have discovery consultation calls now and begin to queue up your concept or discover if there is alignment of your concept with the system change grant so that you're in a better position once the fall grant cycle opens up. In this instance, the proposal is 5 pages and a template budget. We have a much more thorough staff and board review process that not only includes a review of that written application, the 5 pages, but also we, after doing a review of those written applications, invite semifinalists to present their proposal as well. We do this as a mechanism of equitable grant making because we work with a lot of grassroots community-based collaboratives that may not have a full-time grant writer or fundraising professionals. So their written application might not be as strong as possible, but they sure can tell their story really well. So that's why we have that 2-step application for the system change grant, both the written application and then the presentation component. Once our grant review team reviews both of those, our team does that review, and then our board ultimately approves the recommendations for funding. And again, we have an annual grant cycle for this. 3 years funding of $175,000 total. So that is a very broad and then deeper dive look into Vitalyst Health Foundation. Again, the three sides of our house, our grant making side of the house, the technical assistant, or the TAP AZ, our fiscal sponsorship, and then our programmatic priority areas of healthcare, housing, and civic health. And then within our grant making side of the house, those three grant types, the technical assistance grant, the Spark grant, and the systems change grant. I will note as I'm beginning to go back to gallery mode so I can see everybody's beautiful faces or beautiful names. Um, while we have established our grants program as a three-tiered scaffolded grants process, you do not have to start from square one. So if your collaborative is formed, you're just ready to plan, you can jump straight to the Spark grants. Or very similarly, if your collaborative is formed, you've done your planning, you just need implementation funds, you could jump straight to the systems change grant. You don't have to start from square one. You can jump to tier two or tier three. Also, if you do happen to start at tier one with the technical assistance grants or with the Spark grants, you still have to go through the application process for the next level. It's not automatic. So once we close out, say, your technical assistance grant, we'll do a closeout reporting and determine if your efforts now are well suited for the Spark grant. We really do hope so, and that's why we've scaffolded our grants program like that, but it's not automatic funding. You would still have to go through the Spark grant application process, and then similarly from Spark grant to systems change grants. With that, I will open it up for questions. Feel free to use the raise hand function or simply unmute yourself and answer your
I know.
question. You can also put your questions in the chat room and we could answer those virtually. I see the dutiful hand raised. Becky, go for it.
Thank you. Good job. Appreciate you. We received a feasibility grant last year of $15,000. Would that be considered the technical assistance? So now we're on year two, Spark. Like we've got this is your material, the Spark material. So we're ready to jump into this, but we called it a feasibility grant last year and we're working with Gabriel.
So that effort might have been more so connected with our programmatic priority areas. So again, there's different sides of our house, right? So the grant
Okay.
making side of the house, the technical assistance grant, the Spark grant, and the systems change grant, those are all open grants cycles. There are other grant partnership opportunities we have that are directed by the individual directors. So I'm guessing that your partnership was specifically connected to Gabriel's housing portfolio and a
Yes.
feasibility study that he funded through our non-competitive grant program. So that would not be counted as the technical assistance grant or Spark grant or system change grant. It doesn't preclude you from exploring the responsive grant side. So you can still go through the discovery process and determine if you're ready for if you find alignment with one of those three grant types. If your effort is tied with housing, you would have a follow-up conversation with Gabriel to determine that alignment.
Okay. And now we would like to schedule a technical assistance discovery phone call. How do we schedule that discovery phone call?
Yep. In the chat room, Michelle put the link to the website that has that discovery
Okay.
intake form, so you can complete that online. You'll also get the link in a follow-up email that will be sent out shortly with this recording, the slide deck, and that discovery intake link. Great. I see a question in the chat room, and then I'll go to you, Carolyn. So, Bill Staples, hello. Can you please explain where and how justice reinvestment grants relate to these grants, and if they fall under a different category at Vitalyst? Can you provide a brief overview? Sure thing. The Justice Reinvestment Grants are grants that Vitalyst manages with TAP AZ as the fiscal sponsor for the State Department of Health Services. If you're not familiar, Arizona voters passed Proposition 207 a couple years ago that allowed recreational marijuana. And within that initiative, there was a portion of the tax revenue from marijuana sales that was put into a justice reinvestment fund that is held at the State Department of Health Services. Last year, DHS contracted with Vitalyst and TAP-AZ to manage that grant program for them. So the Justice Reinvestment Grant is a completely different grant for Vitalyst. Um, we administered the first year of that grant. We had a grant cycle that you probably saw, Bill. We continue to work with the State Department of Health Services to now, and all of those grant awardees. We have not received word yet from the state if Vitalyst will once again manage another grant round, but we are in close collaboration with them. So long as Arizonans continue to partake in recreational marijuana, and as a health foundation, we can't say one way or not to do that, but the funds are coming in into the State Department of Health Services, but they have say on how those funds are then distributed through a grant cycle. We just haven't received words if there will be another grant cycle, when there will be another grant cycle, and who will manage that grant for them, whether it be Vitalyst with TAP-AZ or another entity. So as soon as we hear word from the state, we'll of course promote it no matter what, because it's a great grant opportunity. But stay tuned. By registering for this webinar, we also are enrolling you in our Vitalyst newsletters, which includes a biweekly newsletter that has a lot of different grant opportunities. We call it the Top Tips newsletter. We send it out every other Tuesday because I'm a nerd and like alliteration and acronyms. So Tap Tip Tuesdays. So you should be getting that in your email inbox on next Tuesday, if you're not already enrolled the following Tuesday. And the Justice Reinvestment Grant would be one of those grants that we promote via that channel. Thanks for that question, Bill. Carolyn, and then we'll get to yours, Christina.
Thanks so much. So I was taking notes and I think I may have missed this. I apologize. Our organization has restructured so that we are creating more collaborative approach, which of course I'm thrilled because 2 years ago we talked to you about Spark. We're moving in that direction.
Right.
The requirement for the Spark Challenge, did you say we do have to first do a technical or the Spark grant before we can go to the second phase grant?
No, it's not. You're not required to start at square one with the technical assistance grant. If you're ready to plan,
move to this.
jump straight to
If we've met with you and we are now on the trajectory that early on in the discussion we didn't quite meet, but now we're there, we can just go ahead and move into putting together with our collaborators the Spark Grant initiative.
Yeah, we might want to reconnect just to ensure that you have the best and that so that we have the most up-to-date information to ensure that you for sure are ready.
Oh, it's changed a lot.
Oh, yeah, perfect. Yeah, then let's go ahead and reschedule. So we can make note, Carolyn, Michelle, if you can do this, because you might want to start a new discovery intake form. That might be the best approach. And then you can update that discovery intake form with the latest with your project, and that'll help guide and facilitate the next steps on that front.
You just answered the next part of my question. So Michelle, I've opened the link. We'll get that started. Thank you.
Love it. Thanks, Carolyn. Christina, in the chat, do you want to unmute yourself to read this, or do you want me to read it? You're really challenging me because you see I'm struggling with my throat. I'll read it for you, no problem.
Okay.
Thank you for this overview,
Sure.
Christina says. Oh, go for it.
Sure. Are you able to share Vitalyst budget for each of these grant areas in a given year, or conversely, how many grants in each of these categories do you typically award each year?
Sure. They change every year because we have an annual budget setting process. But in general, so for instance, this fiscal year, our board has approved funding for 4 systems change grants. So those are 4 grants of $175,000 each. Usually we hover between 3 to 5, so you can get a sense. The systems change grant is probably the most competitive grants because there's only funding for 4 on average. And we have received This year we received, I think, or 40 or so initial applications, but we have received as many as 100. So it really depends on the year, but pretty competitive. For the Spark grant, this fiscal year, we have funding for 10 Spark grants. I believe these are 10 grants of $25,000 each. So if you do the math, that's $250,000 total. We might have the ability to add the total amount grant type we have or total amount we have for this. We're in discussion with our board right now based on the pipeline of Spark grants we have. So we do have that spring deadline coming up. So we still have capacity for funding in this for Spark grants. And then for technical assistance grants, this amount varies because the grant type varies, right? It's up to $20,000. But we typically have, for this fiscal year, depending on the grant type amount, between funding for 12 to 15 technical assistance grants. So similarly, around $250,000 to $300,000 for technical assistance grants. But again, this one varies. The specific type or the specific amount of grants varies depending on the amount of the grant size.
Great, thank you. That's helpful.
Yeah. Vitalyst is a relatively smaller foundation here in Arizona. So if you did that math, our total systems change grants budget is usually around $1.2 to $1.5 million. Did I answer all of your questions, Christina? I think so. Brilliant. We're coming on to the top of the hour here. We'll have a few more minutes if there are any lingering questions. Awesome. I'm not hearing or seeing any. No matter, we have an open door policy. So if you have questions that come up later, feel free to send us a note. If you do just want to explore partnership, discover partnership and see alignment, please do complete that discovery intake form. That's how we kickstart the facilitation and the relationship building with your efforts. Just go to vitalysthealth.org and to find that discovery intake form. Again, we'll send the materials out here shortly and really appreciate your time and interest in discovering partnership with Vitalyst Health Foundation. I hope you have a great Friday and a healthy weekend. Take care.
David, I do have one more question.
All right, go for it, Becky. I can stay.
All right. So I'm on the website here, and I was trying to find the discovery call. I see your name, and I see says David, but I don't see where it clicks to the discovery call. How do I find that?
Yeah, no worries. You should be on a page that the visual image is somebody climbing and receiving help on a mountain. Announcement, Vitalyst Partnership Discovery is open. If you scroll down, you'll see the different types of grants we have, so you can take a deeper dive. And Michelle is sharing her screen. Awesome. So hopefully you should be seeing the screen.
Okay. So I saw that. Thank you, Michelle. Okay, I'm going to click on grants. I clicked on grants. It says read more.
Perfect. And just continue scrolling down. This is where you do more research around the specific grant type. And then here is where you'll see the Vitalyst Health Foundation discovery form. Click start now below to begin the discovery form. So just click start now.
I found it. Thank you very much. All right, Michelle, appreciate you. And David, have a good day.
Yeah, take care.